Here in Washington, D.C., we're reminded of our nation's great values of equality, liberty, and justice for all. Our country is beautiful for its diversity. We are a melting pot of all types of languages, cultures. In healthcare, patients struggle to get their voice heard across the language barrier. So many patients speak so many different languages, and it's hard for our healthcare providers to communicate with them. That's why I, Jaden Banks, co-founder of Doctors United DPT, developed a language translator to ensure that every patient voice is heard and quality care can overcome any barrier.
Millions of patients struggle to communicate with their doctors all around the world. These misinterpretations become misdiagnoses, which can be fatal for patients. A classic example is the Willie Ramirez case, where one simple misinterpretation led to Ramirez's permanent paralysis. I'm Anthony Ivanvaca, co-founder of Doctors United DBT, and we're fighting to ensure that these tragedies never happen again.
The current mainstream solution of live interpreters called from a tablet is limited. Faulty internet connection, they're spread out all across the hospital floors, and human resources are limited. The truth is that these tablets are very limited in their ability to provide a consistent, reliable translation, and that's where we come in.
Doctors United DBT is an AI-based translating app that specializes in dialect recognition and precise medical translation. Our software will be end-to-end encrypted, compliant with HIPAA, using smart on-first standards to ensure patient privacy. Additionally, our software will record transcripts of conversations to ensure that patient information is accurately stored in medical records. The main distinguishing feature our product offers that is absent in other translating models is our built-in confidence meter. This confidence meter self-reports how confident AI is in its translations. High confidence will be displayed in a green bar, low confidence in a red bar. When confidence is low, a live human translator should be called to secure that accurate translation. Our goal is not to eliminate live translators, but our goal is to acknowledge that it is a limited human resource and it is expensive, and it should be reserved for when confidence is low, not for standard clinical procedures.
Working in healthcare, I saw the language barrier firsthand. This motivated me to develop my very own web-based application. I've been able to test our app on an actual hospital floor. At my job, I've had my coworkers use it, our nurses use it, and we've had a lot of success translating conversations with our patients. I've even conducted over 50 interviews of healthcare staff, and I've seen validation of our issue. The language barrier remains a big problem, and our solution, our app, can be the solution to eliminate the language barrier in healthcare forever.
Addressing universal healthcare will require calculated and intelligent innovation. At Doctors United DBT, our vision is not to remain limited to America, but to extend to all corners in the world, including refugee camps that Jane and I personally went to visit. Me and Jane both work in caretaking roles in the field of healthcare. I personally work at a nonprofit organization that is a home for people with disabilities. This has given me a patient-first perspective to prioritize patient dignity and well-being.
Our business model is going to be focused directly on business-to-business sales. We're going to be focused primarily on clinics, hospitals, and healthcare systems. We're going to be pricing our service as an annual subscription, which will most likely vary on a case-by-case basis, depending on how many clinicians we're servicing and other logistical requirements. Our marketing strategy is going to be focused primarily on the executives of these facility managers, these healthcare CEOs. We will also be having a conference plan strategy where we go to different health conferences and we pitch our app to build a broader network and reach all facilities and all hospitals in the United States.